Right. Hi, everybody. I'm Malcolm Reed. I am the program manager for the Silver Lining Project at Thrive SS. I'm also the federal policy chair for the U.S. PL-HIV caucus. And I want to welcome you to the WTF, what's in this folder or what's in this file, or that acronym stands for something else on social media, which we might find if we talk about the situations that we're in right now, we might find that acronym apropos. But this is also not only what's in this file, what's in this folder, but this is new advocates training. Last year, we did an in-person session for new advocates, and it was very successful. It was very interactive. We broke down into groups and we talked to people about telling their stories to their congressional officials. And it was very successful, and we wanted to bring it back this year. Obviously, we can't bring it back in that same format this year because we are virtual, but we're going to do our best to make sure that you guys get everything that you need out of it in order to talk to your congressional officials. The first thing I'm going to do is introduce Emily McCloskey. Emily is the Director of Policy and Legislative Affairs at NASDAQ. And Emily will talk about go through the policy briefs. And then we'll start talking about telling your story based on those briefs. So Emily, I'll turn it over to you.
Thanks, Malcolm. I'm just getting this set up. Hey everyone, thank you so much for having me here today. I think this is truly the most appropriately named session because this time in our lives is really truly WTF. But you know, whether it's what's this folder, what's the file, what are the facts you're going to learn today, I'm going to take it some time and go through what the asks are in our policy briefs. And because even though the world has seemed to completely have changed in the last few weeks, our asks and our passions have not. So we're going to start off by talking about the appropriations section. So I just wanted to give some background on what appropriations is. People who work in DC, including myself, tend to be incredibly wonky. I love to nerd out over budget, but they aren't exactly straightforward. So the appropriations process is the process in which Congress decides on how much funding to give each program that's within the government. So that can include that it really focuses on discretionary funding, which means it is at the discretion of Congress. So that includes things like HIV prevention, hepatitis prevention, HOPWA, the Ryan White program. And it also includes things like TSA. You know, the Department of Defense has a large budget. So Congress every single year goes through a process in which they decide how much funding to give to each program. That process starts in February when the president submits their budget request. The president budget request is just that. It is just basically like their dream scenario where the president submits every single funding line that and the way he wants it to be. Congress sometimes goes along with this. They sometimes throw it out. Then Congress in a normal year will meet in both the House and the Senate separately. They'll come up with their own funding lines. They'll come together and then they will vote on their individuals. Then they'll come together through a conference process and they'll come back with one bill where they will have decided on the final funding for the year. This can sometimes include emergency appropriations, which is I will talk a little bit about just in light of COVID-19. But I just wanted to give a quick overview of sort of the appropriations process. So on this chart, you'll see this is the chart of asks for AIDSWatch. There's more than just a slide, but I'll go through them quickly. So we have the 2019 final, the 2020 final. FY 2020 actually began on October 1st of 2019 and it goes through September 30th of 2020. And so right now we're working on FY 2021, which will begin on October 1st of this year. The president submitted his budget request in February, and then we also have a coalition request. This is the AIDS Budget and Appropriations Coalition's chart, which is a subgroup of the Federal AIDS Policy Partnership. If you're interested in learning more about that, please let me know. I'm one of the co-chairs of ABAC, as is Carl Bologna at AIDS United and Nick Armstrong from the AIDS Institute. So you can see the coalition requests are different than the final and the president's request, and that's because they sort of represent actual need. And we all know that if we really want to end the HIV epidemic and address our other epidemics, we need a significant influx of funding. So the president's budget did request an increase of $231 million for HIV prevention for the Ending the Epidemic plan. It flat funded viral hepatitis prevention, STD prevention, and TB elimination. And then there's a line at CDC called the opioid-related infectious diseases line, and this is really focused on HIV, hepatitis, infective endocarditis, and other areas where we know that the opioid and just injection drug use in general has really exacerbated new and increasing infection rates. So the president did request $58 million, which is an increase of $48 million for that line. Then we move to HRSA, which is the Ryan White program. The president's budget requested flat funding for all parts, and then a $95 million increase for the Ending the Epidemic initiative there. The president's budget also included $87 million for community health centers that is focused on the Ending the Epidemic plan. That's where we see a lot of the prep work happening. It did request flat funding for Title X, which is the family planning program. NIH was significantly cut in the president's budget, but especially when you're thinking about NIH, don't let that red scare you. Congress always funds NIH and usually provides increases for them. You see that AIDS research was also cut, but the ETE provision of that was actually increased. One thing we really agree with the president on is that they zeroed out the sexual risk avoidance or the abstinence only program in HHS. They also unfortunately zeroed out the teen pregnancy prevention program, which addresses sexual health overall, not just teen pregnancy. So it does address HIV and STDs. We are looking at, in terms of SAMHSA, there was a significant or a cut there, and we're still waiting sort of on the Minority AIDS Initiative number at SAMHSA. But the minority HIV/AIDS, or we're waiting for the total Minority AIDS Initiative funding. We have the Minority HIV/AIDS Fund and the SAMHSA Minority AIDS numbers, which were both flat funded. And then Indian Health Services also has a provision of the Ending the HIV Epidemic Plan, and that was not funded last year. So the administration requested $27 million for that this year. And unfortunately, HAPWA the president proposed cutting that by $80 million. So definitely don't want any of those cuts to happen. One thing that's not on this chart, and it's because it's really late breaking, it just happened on Friday. So I talked a little bit about emergency appropriations, and those can happen. They're fairly rare, but in the COVID-19 CARES Act, which passed and was signed into law on Friday, they did include quite a lot of emergency appropriations. So there was a significant amount of money that went to CDC. It is unclear if that will be going to the Center for HIV, Hepatitis, STD, and TB prevention, but there was $90 million included for the Ryan White program and $65 million included for HAPWA. So we were happy to see that the impact of COVID-19 on people living with HIV is recognized. So the talking points that kind of go along with this, and as you're thinking about your online advocacy, you can think about this, is that we want to see increased funding for the Ryan White program. We know that this is the only federal safety net program that's designed for people living with HIV, and we know that it's incredibly successful. So we really want to continue to see increased funding there. And at the Ending the Epidemic program is incredibly important, and we are excited to see that exist, but we also know we can't leave the rest of the country behind. 57 jurisdictions is not our entire country, and we need to make sure that the Ryan White program across the country is funded. We want to see increased funding for HAPWA. It's the only dedicated federal housing assistance program for people living with HIV. An $80 million cut is unacceptable. The Minority HIV/AIDS Fund, it's formerly known as the Secretary's Minority AIDS Initiative Fund, or SMAIF. Doing some name changes this year. So we want to see increased funding there because we see a lot of innovative projects come through there that can be spread when they're successful to other programs. We want to see increased funding for CDC's Division of STD Prevention. You heard David talk about the STD needs. And then I talked about how the Indian Health Services ETE initiative was not funded last year. We'd like to see that funded so that we can ensure that there's care and prevention for our American Indian and Alaskan Native communities that are impacted by HIV. And we want to lift the ban on syringe service programs. Currently, the legislation says that you can use funding for programs, but you cannot purchase actual syringes. So our ask is to pass appropriations legislation that removes that restriction. That's critical to preventing overdose deaths and the transmission of infectious diseases, especially viral hepatitis and HIV. So the next segment of the policy briefs is access to care. I think we all know that healthcare remains an essential component of ending the epidemic. I heard Robert talk about sort of the importance of the ACA, but how we need policies that secure access to antiretrovirals, PrEP, and that address the social determinants of health and the multifaceted barriers that impact health and well-being. So we have some congressional actions that are surrounded our access to care asks. So the first is to increase investment in the Ryan White program, which we talked a little bit about. Also to ensure that all forms of health insurance cover the full range of antiretroviral therapy, and that means in Medicaid, in Medicare, or through the marketplace, and employer-sponsored health insurance. We also want to see an expanded awareness and access to PrEP, and one way that members of Congress can do that is by co-sponsoring the bills such as the PrEP Access Coverage Act, which was introduced by Senator Kamala Harris in the Senate and Congressman Adam Schiff in the House. And you can look on congress.gov to see if your representatives are on those bills, and that's a great place to try to have them show their interest in expanding access to PrEP. We also want to make sure that there's no cost coverage when the United States Preventive Services Task Force has said that there should be no cost coverage of PrEP, but we need to ensure that includes laboratory tests and clinic visits. Otherwise, we know that care will be restricted. And we want to see that there are innovative care models that address social determinants of health. We need to address housing, we need to address food, we need to address employment and transportation if we truly want to end the HIV epidemic. Brings me to civil rights and human rights. Violations of civil rights and human rights threaten to exacerbate these existing disparities in the HIV epidemic, and we need to combat bigotry and discrimination through the federal government. So the first place to start there is to support the repeal of state HIV criminalization laws. We know how impactful state HIV criminalization laws are, whether it's on stigma and just people's personal lives. We need to eliminate them. We also need to protect the privacy of people living with HIV by protecting against the misuse of molecular surveillance. We want to see reforms to the criminal justice systems. The First Step Act was passed last year, which passed sentencing reform, but we need to phase out the use of private for-profit prisons and eliminate racialized risk assessment. The For the People Act, which is HR 1, that means that it was the House of Representatives' #1 priority when they began their term last January. And we want to see that passed. It supports comprehensive campaign finance reform, talks about the ethical nature of the government, and most importantly, I think ensures and protects voting rights. We also know that we need to enact comprehensive immigration reform that protects the due process of law and ensures access to healthcare for immigrants, particularly those who have been detained by law enforcement and immigration authority. We support the collection of SOGI, which is sexual orientation and gender identity data. That will allow federal agencies to actually understand and better serve LGBTQ+ people. And we want to ensure that all federal agencies are directing services to transgender people, and that shows that they are actually focusing on them. We want to hold them accountable. The Equality Act would enact explicit non-discrimination protections for people, for LGBTQ+ people in areas of life. So it would essentially be like, you can't get fired for being gay, you can't get thrown out of your housing for being trans, you have to be given public services, and we want that to be passed and enacted into law. And we want to see Congress lead a congressional hearing about and report about the increased violence against Black transgender women. And we need to find community-based alternatives to preventing this violence. We'd also like to use congressional oversight to oppose the continued attacks on transgender rights. We've seen quite a few horrific things come out of the administration, and we'd like to see Congress hold them responsible for those and change those rules. And we'd like to enact legislation to allow a gender-neutral option on all federally issued identification cards, so like your passport, and it should also encourage states to allow a gender-neutral option in name or gender marker changes on their state-issued identification. So that would be more like your driver's license. And then, of course, we want to support the full implementation and enforcement of Section 504 of the Rehabilitation Act and the Americans with Disabilities Act, which would ensure that federally funded HIV programs are accessible to people with disabilities. So last but certainly not least, we want to talk about sexual health throughout the lifespan. We know that people of all ages deserve sexual health information that promotes their health and well-being throughout their lives. Information should be comprehensive, including information about preventing HIV, other sexually transmitted diseases, and unintended pregnancy. So to start there, we want to support adolescent school health promotion programs, including the Personal Responsibility Education Program, or the other PrEP, the CDC Adolescent and School Health Program, and the Office of Adolescent Health's Teen Pregnancy Prevention Program. If you remember from before, the Teen Pregnancy Prevention Program was zeroed out in the president's budget. And we want to really ensure that those are fully funded because they prioritize evidence-based, medically accurate interventions. The Real Education for Healthy Youth Act, or the REAL Act, and the Youth Access to Sexual Services, or the YAS Act, would support these new initiatives for adolescents and young people, ensure that there's LGBTQ+ inclusive education, and provide grants to improve and increase linkage to care of marginalized young people to sexual and reproductive healthcare and related services. We want to eliminate the federal abstinence only until marriage program, which prohibits the teaching of the benefits of condoms and contraception and fails to address the needs of young people who are already sexually active, survivors of sexual abuse, and the LGBTQ community, or TQ+ community. And unfortunately, that was also reauthorized in the COVID-19 Cures Act on Friday, only until November. So I think it's once again incredibly important that we talk to our Congress members about how this is unacceptable. Unfortunately, one of the things that the administration has implemented is a gag rule on Title X, which basically presents access to critical providers and further exacerbates existing disparities in care and treatment. So you cannot receive any federal funding if you even refer out for abortion services, which drastically cuts the safety net network. And we believe that people living with HIV should be designated as a greatest social need population in the Older Americans Act, which would open access to crucial services like meals and job training, senior centers, health promotion, benefits enrollment, and more for people who are aging with HIV. So now I'm going to turn it back over to Malcolm and Ronald, who are going to talk a little bit about how you can advocate on these issues.
Thanks, Emily. We really appreciate it. And just as a note, we see your questions in the question box, and I know we're running a little bit behind, so I'm not sure for all of them, but we will be answering those questions. And for the folks who wanted to know where you can get copies of the ask and copies of the slides, they will be sent out after the session. So Emily went through a lot of asks, a lot of things that we want the federal government to do, and we want Congress to respond on. And so the question then becomes, how do you as an advocate get that information over to your representatives and make sure that they are doing what you want them to do? And it's all about storytelling. As Andrew said in the previous session, telling your story is very, very important. We are used to telling our stories. Normal AIDSWatch, we go to the Hill and we are able to tell our stories personally, but now we're in this virtual world. So we're going to do a little bit of a mix. We're going to talk about how you tell your story in person and how one experienced advocate has been doing that. And I'll let Ronald tell you more about her and how she's doing that. And then we'll start to take some questions and suggestions and go from there and talk about how we advocate virtually. So Ronald?
Thank you, Malcolm, and welcome everyone. Really happy to be part of this virtual AIDS Watch and this particular session. I know we have limited time, so I want to go straight into introducing Tammy. Tammy is an advocate, a fierce advocate for people living with HIV. She's a member of the Zero Project staff, and she is on the steering committee of the U.S. People Living with HIV caucus. And we are very happy to have asked her to give an example of telling your story. And we realize certainly that in this new environment that we are in, and we may be in for a while, we have to be very creative about telling your story. So we are very grateful for the example, one example that is forceful, and I think Tammy is the person to give that. So I will turn this over to Tammy.
Tammy, I think you're on mute.
Tammy, can you unmute your phone?
She's unmuted here through the, on Zoom, so I'm not sure.
Hi, Tammy. You can begin giving it your example of telling your story.
I'm texting her. I'm asking if she can hear us. Okay, so I'm not sure if she can hear us, so let me give an example while we're waiting for Tammy. So one of the legislative asks is the expansion of Medicaid. In a lot of southern states, Medicaid was not expanded. And we know that there are plenty of people who are in that what is called the donut hole. They make too much money to get any help, but they can't afford health insurance. And it is really coming to fruition now with COVID-19, because there are so many people out there that need to seek medical care. And they're talking about free testing, but you know what? You can get free testing, but if you're positive, what about your medical care after that? And so what you would do as an advocate, if you were living in a southern state where you're in that situation, where you don't have health insurance because they didn't expand Medicaid and you just don't make enough money to go out on the exchange and the subsidy is not good enough for you. And so you would go and you would talk to your representative and you would say, look, I'm here to talk to you about the expansion of Medicaid, and here's why. I'm in a situation where me and my family don't have health insurance, even though it was mandated under the ACA. And yes, they took the mandate away, but I still cannot afford health insurance because of the fact that Medicaid in this state has not been expanded. And you can go into talking about how that's affecting you financially, how maybe your children can't get care, your spouse, you can't get care. So those are some of the things that we want. You look at each legislative ask and you say, well, how does this affect me? Cause and effect when talking to legislators is very, very important. It puts a face on their vote. And I was even told by a representative once that if you tell an effective story, when they go to vote, yay or nay on a bill, they actually see your face in their head. So, it's something that is very, very important. So I'm not sure if anybody else wants to jump in and has any other examples, but Tammy did not respond to my text either, Ronald. So I'm not sure. Hey, Tammy, you there?
Tammy can hear us, but for some reason, she's not, we can't hear her. She's
Okay.
using the phone line, so I'm not sure. We're trying to figure out what's happening now.
Okay, all right.
It's going to continue. Sorry.
So Ronald, did you have anything that you wanted to add?
Well, I think, thank you, Malcolm. I think among the various stories and being able to speak, and we'll be talking a little bit more about this later in this afternoon, but certainly one of the issues that it's very important to highlight, and particularly at this time when we can't have in-person meetings. So we need to discover ways, and Andy gave some good examples of how to use social media, and we'll be learning more about that after this session. But I want to say particularly to those of us who are living with HIV and 50 years and older, that it's important to tell our story. Certainly in terms of using myself as an example, I am a person over 50, into his 70s, and I've been HIV positive, or I've been diagnosed with HIV for over 30 years. And people living with HIV over 50 really have emerged as the majority of people living with HIV. And so it is very important for our stories to be told, and that what we need and our concerns, which are very often forgotten, are heard. And I know I'm going to talk about myself personally. I am not the most adept person at Twitter, so I really am challenged in this new environment to learn about new ways of communicating, because it's essential that we communicate and get our messages, our needs and concerns across. So I am just really, in this sense, a new advocate in this environment, because I have been a veteran of making in-person visits, but I share some of the challenges, and I really want to speak to all of the participants to say that we need to expand our skills. And it's very important for us to continue to be engaged. So that is one message that I really want to share, particularly in this context of new advocates orientation, and want to welcome those of you who are new to AIDSWatch, and in this, it's a little strange that your first AIDSWatch is the first virtual AIDSWatch, but we need to all be included, because I said we're working in a new environment. So it's calling for us to expand our skills, use those skills of social media that we have, or for those like me who are learning and being challenged. And I want to say that I am rising to the occasion. So that's part of my story, because I think it's important for people, all people living with HIV, including those of us who are over 50, to get our story told. And as I said, there's going to be a session later on this afternoon where we'll talk more about that. But this is one example of what the importance of telling your story.
And Ronald, I think Tammy is audible now. Tammy?
Yeah.
Yeah, sorry about that, everyone. Thank you so much for filling in and working with us as we go through the technical issues. So I did type into the box, like my mantra, especially when talking with legislators, is tell your personal story and leave the fact sheets, especially on the federal level, because it's usually the staffer who looks at the fact sheets and depending on what the ask is. But the legislator will remember your story more than they would any numbers or that we could provide or anything like that. It's your personal story, and that's why it's so important for people living with HIV to talk to legislators. One, to put a face on the epidemic. So when a bill does come up around HIV/AIDS or the funding or all the different asks that we have, they'll go back and they will remember what you share. So it's so important for everyone to share that story. The other thing that I wanted to say is before you talk to them, one, practice and write it down. And, you know, depending on the day, on the situation, it's okay to even have it written down when you go to talk to the legislator. It can be intimidating. You shouldn't let it intimidate you because, one, you need to remember they're working for you. So you're actually the boss. But it can be intimidating. I've had brain farts in the middle of talking with when Senator Harkin was still our wonderful senator that we were proud of in Iowa. You know, I was in the middle of a sentence and I forgot what I was saying. So by having it practiced and having your story and your ask, very important to have that ask written down, if you do get stuck, you can go back to what you wrote down and be prepared for that. And I apologize, Ronald and Malcolm. Did you want me to do a quick 3-minute, what I would ask the legislators if we were in DC?
Yes, please. Thank you.
All right. So I am going to address this to actually Senator Reid because I believe Malcolm should run for office, and I would be proud to have him as my senator. So
thank you.
I'm putting that out there, Malcolm. Hi, Senator Reid. My name is Tammy Hott. I am your constituent from Nashua, Iowa. I have been living with HIV for 26 years. I am a mother who never expected to live long enough to see my son graduate high school when he was born in 1996. Luckily, I have had access to care and treatment. Since seeing my son graduate in 2015, he has escorted me down the aisle for his wedding in 2018. He has given me 2 amazing grandsons that I love and spoil. As I said, all of this is possible because I have had access to quality care and treatment. With advances in HIV care, treatment, and prevention, the U.S. now has the tools to end the HIV epidemic. Do you support passing a budget that adequately supports access to high quality and affordable health care, including the intersectional issues of opioid use, hepatitis, and sexually transmitted infections, among other things? Also, advancing budgets that address the social determinants of health, including housing, food and nutritional services, transportation, and other essential services that are a part of the healthcare needs that people living with HIV have. I hope you will see the need for these services for people living with HIV to live full, healthy lives and be able to be there for our family and friends.
Well, Tammy, thank you for that information. That's a pretty big ask. Do you have anything that I could look at? Because when you talk about access to care, you talk about social determinants, housing, and those other things, transportation. That sounds like a big bill. Do you have any numbers for me?
Actually, I don't have specific numbers that I could share with you. However, I am here with AIDSWatch, one of the largest gatherings of people living with HIV in DC. And we have created this folder with information on the budget and appropriations, along with other important issues to the HIV community.
Very good, thank you. If you leave that with my aide, I will make sure that I take a look at it, and we'll see what we can do.
Thank you, Senator Reid. You are amazing.
Thank you. So yeah, that's it. Hand clap for Tammy. Now we know that all of your congressional representatives will not be as amiable as Senator Reid, and so the other thing that we must say is make sure that you study the briefs before you go in. Make sure that you have some answers, and you can refer to the briefs, but you might be able to say, and in this brief on page so-and-so, you will know what this number is. And again, emphasize again why this is important. And then when I think about this virtual world that we're in, and our younger advocates on the call will be able to educate us probably about videos. If you don't feel like typing out a message on Twitter or anything else, get your speech prepared and do a 2-minute speech and send it out on social media. Just the way Tammy did it just now, but get your points across and send it out on social media. That's also a way that, either them or their aides will see that video and be able to, address some of the things that you asked. So yeah, so is Tammy, Ronald, anything else for you guys?
I was just going to say, and one reason why I said I didn't have numbers, because one, I'm not a numbers person. If you don't know an answer to a question, just let them know, the legislators know, that you don't know what that answer is, and you will follow up, and then just make sure that you do that follow-up email, or make sure that you let AIDS United know, and they will make sure that the legislator gets the information that they asked for. That's very important, along with sending a thank you email for seeing them, and then once again, highlighting the different issues that you asked or that you discussed, because that is important, especially, here in Iowa, when on the state level, when we were modernizing our laws, every year I would, at the end of the session, send a thank you card. And legislators said, it's amazing how few people acknowledge when they've done something good. Everyone complains, but nobody thanks legislators, or few do. So if you also do that, acknowledge the meeting, that will leave an impression with them.
Exactly. And I think you said something very important. It's actually gold. Follow up. A lot of people come to AIDSWatch, they talk to their legislative representative, and then they don't follow up. So it appears that it's not important to you, so therefore it's not important to them. Follow up is very important. And somebody posted in the chat box, and I saw the name, but it scrolled and I lost it. But somebody wrote, a handwritten thank you or a handwritten note is also good. An email is great, but somebody wrote in there that a tip from their senator that a handwritten note is very memorable because they get so few of them. So that might be a tip that you might want to use. The idea is to use Twitter and social media.
And Malcolm, I also noticed in the chat box that there are a number of new advocates, new to AIDSWatch, that is, in the session today. And again, I just want to really give a shout out and recognition of those of you for whom this is your first AIDSWatch. And I'm very hopeful that this will get you on the road to speaking and communicating directly with your members of Congress and your state and local legislators, because that's where the AIDS message has to go out also, not only to Congress, but to your state and local legislators. And the same techniques that you've heard and the same way that Tammy has talked about and the points that Malcolm has made, they work on the state and local level also.
Exactly.
Great. Just one quick note for folks. Carl from AIDS United puts links to all of the policy briefs in the chat channel, so folks can scroll up and find those if you don't already have them in your email or otherwise. That's all.
Okay, great. Thanks, Kenyon. All right, so if there is nothing else, we're going to move to Christopher Cush of Soapbox. And Christopher is going to talk to us about some of the logistics in this virtual world. Christopher, are you there?
I am here.
How you doing today?
Good. Oh, you can hear me.
Yeah, I can hear you. I can hear you, and I'm looking around. I don't see anybody near you, so I'm assuming you're safely social distancing.
I'm 6 feet away from everyone right now. It's not a good way to be, but it's how we are right now.
Yep.
I appreciate being on the phone with you and hearing all those great ideas and seasoned advocates. I know the first time I did this stuff, if I could have had 3 pros tell me from their point of view what gets through to an elected official, that to me would have been the key information. You know, all the details, they're complicated, but what you shared there was really informative. So thank you for that.
Thank you.
Tomorrow, there's going to be, I'm Christopher Cush with Soapbox Consulting, and we schedule the meetings for AIDSWatch every year. And so obviously this year we're doing things a little differently. So you are, if you are on this call, you are going to be encouraged to reach out to your elected officials to respond to action alerts, not just once, but throughout the year, and to become an advocate that stands up and is counted and is heard and is seen and is considered throughout the year to help us get the funding that helps saves lives, the treatment that people need, and the future breakthroughs. Now, there's a smaller subset of folks that we have scheduled conference calls with tomorrow for appropriators. And appropriators are the folks on Capitol Hill who are in charge of babysitting the funding that we get each and every year. Every year we have to go and talk to the appropriators, tell them what we did with what we had, and tell them what it looks like we need. So we wanted to make sure that those appropriators hear from us sooner rather than later and hear from us all together. So if you are in the district of an appropriator, either you live in the home district of an appropriator or the state of a Senate appropriator, you should have received an email from Soapbox saying that you've been selected to also do a conference call tomorrow. And if you responded to that email, then you will have received a code for the mobile tool. So the mobile tool, we're using it just this year for these conference calls. And I had a couple slides. I'm not sure if we can see the slides, but I'm going to sort of talk you through how the mobile tool is going to work tomorrow if you are in one of these appropriations districts. So if you could just go down, if we've got it. Nope, doesn't look like we have it. It's all right. I'm just going to describe it to you. If you log on to the mobile tool, again, it's not an app. Again, it's just for folks who've heard from us. You go to a website called sboxmobile.com. You put in your code. It will tell you the time of your conference call or calls. And at the end of that meeting line, it will have your call-in number and your PIN. So that's every single call tells you when, what number you call, and what the PIN is. These are conference calls, so there is no Zoom, there is no video. Every single call is going to have a group leader. And if you press, when you look at a meeting, if you press meeting roster, you can see who your group leader is. And that's going to be the person who organizes the comments and makes sure that while we are on the phone to talk about HIV and AIDS and about these programs, that we stick to those issues. It's what the staff is expecting to talk about, and we have extremely limited time on these conference calls. So you can see who your team leader is by pressing roster. You can see the call-in number and the PIN by looking at your meeting time. And then right when you're done, the second you're done, you can press feedback and let us know what the Appropriations Office said. That's very important. It's not just if somebody changes their mind. It's not just if an office that wasn't friendly suddenly is friendly. It's no matter what you talked about, you need to give your team in DC some details so that they can continue the conversation. There's a very strong argument we can make when the people in DC who represent people all over the country are able to show that when elected officials talk, you out there in the field hear what they're saying, and you are in the field seeing what they're doing. So what we want to do is make sure you give us feedback right away so we can share with them that we're in touch with the field, and we're going to see all over this country if we get adequate funding. So you have your meeting, and in second you're done, you press this bullhorn and give us some feedback. The final thing I'd like to say is that unfortunately tomorrow there are going to be some misconnections. This technology thing, as everybody probably knows already, it doesn't always work smoothly. It might never work totally without needing a minute for somebody to log on or somebody to refresh their memory about the PIN or change a number. There's going to be some misconnections. So we're going to have live assistance for you. And on your mobile tool, there's just a button you can press. If you need live help from Soapbox, it's the Congressional Help Desk, but I'm also going to give you the phone number, 202-362-5910. That's the help desk phone number. If you're trying to call in and the connection's not being made, the staffer's not getting on the call, here and there, something's going to happen. It's okay, we're anticipating it. We got to work to get folks together sometimes. You're just going to press your help desk button or call the phone number, and we will have live folks to help you. So now that is all I have to say at the moment, but I will tell you, if you have questions that are specific to your meeting, we're happy to answer them. Maybe we'll answer them offline because we have lots of folks here who are going to be doing different things, and this is just a subset. So I'm going to ask you to email Drew or Nora or Carl, or you can email me at kush@soapboxconsulting.com, or you can respond to one of the emails we sent you. So whatever's easiest. What I just mentioned, that is a way you already have an email, send us a question that way. We'll reach out to you directly and we'll answer your questions. Tomorrow, 30 appropriators on Capitol Hill are going to hear from us. They're going to hear our stories, and they're going to be in a position to keep funding these key programs and even increase the ones that need to be increased. So I salute you, and I thank you so much for staying active, involved, and vocal, even with COVID-19 out there. And with that, I'll turn it back to you, Malcolm or Ronald.
Thank you, Chris. Appreciate that. Let me ask you one question. I didn't see this in the chat box, but this came up last week when they were debating the $2 trillion stimulus package. Do you believe, or does anybody know if that $2 trillion is going to take money away from any of the programs that we're advocating for?
No, right now it's not supposed to. So what happens when people pass a gigantic bill, then people have to backfill. How does all this stuff work? So there will be additional details about how funding is going out. But no, it's not impacting or taking money from anything else. However, we are not done appropriating for 2021. So what we want to do is we want to make sure that people don't say, well, in some way, shape, or form, we've got $2 trillion coming to the American people. We want to make sure that the money we appropriate to handle these programs is still appropriated. These programs have to stand strong, and they have to stand on their own because these programs are saving lives. So it's very important that we continue this conversation and we show people we are watching, even if we expect that that $2 trillion won't touch some of the programs we heard about today.
Thanks, Christopher. And I know there's been some questions and rumors about this. So initially, before there was any emergency appropriations, the secretary did use her power to redirect some funding, and that did include some funding from the center. That was all restored in the first COVID bill. So all funding that has gone to COVID is actually exclusively for COVID-19. It does not come from any HIV, hepatitis, TB, or STD programming anymore.
That's good to hear. And Christopher, before you go, a couple of notes in the chat box. Can you repeat your email?
My email is kush, K-U-S-H, at soapboxconsulting, all one word, .com.
All right, and it's been posted in the chat box. Thank you very much.
Hey, Christopher, this is Ronald. I saw a question in the Q&A box. For tomorrow's call, will the congressional offices, will they have received the policy briefs, or how are the policy briefs going to get to those officers who will be on the call tomorrow?
The offices will all have received a copy of the policy briefs and a roster of who will be calling in. So they'll be expecting specific people to call in, and they'll be expecting the conversation to stay related to those policy briefs. But the advocates, you each have a copy of these things under the Documents button on the mobile tool. So advocates that would like to send an additional email or share those policy briefs can do that. I say that because we're sending them the policy briefs, but the inboxes are overflowing right now. So please know you can always say, don't worry, there's a copy right here and you can send it from the mobile tool. Just press the Documents icon.
Thank you, that's very helpful.
Thank you for asking.
All right, do we have any other questions in the chat box that we want to go through before we break?
Yeah, I can just pull up some of the ones that I see here, if that's okay with y'all.
Yeah, that's
might
fine.
be helpful. So one question is, how do federal payments get sent to Ryan White Part A subrecipients, since many are working from home offices? Does that make sense?
So for that $90 million, it can be spent over time. It is actually has the ability to be spent over multiple fiscal years, and is going to be spent as a supplemental to existing contracts or grants. That is at the Secretary's discretion. We probably won't know more details about sort of the allocations and what that means for the next 30 days or so.
Great. And then there's a question about ending the epidemic funds. Were the funds that were allocated from Congress new money, or were they part of the Minority AIDS Initiative or other sources?
Those were new funding.
Perfect. Let's see. Okay, so only the certain jurisdictions are receiving any epidemic funding. How is HHS and CDC going to ensure that rural areas are benefiting from this funding? Rural areas, let's say, are outside of the counties and the few states that are receiving funds?
So I think one thing that's been incredibly important to us as we're doing advocacy is to ensure that the base funding for Ryan White and HIV prevention doesn't change. We don't want the ET money to come out of that. That's why we've really pushed, and we've been successful of getting the ET money to be new funding. So the existing funding lines are the same, and rural and areas outside of those 57 jurisdictions will continue to receive the funding that they've been receiving from the government. And I think what's important is, we're only in year one. We're really only in the planning stages, but as people are planning in those 57 jurisdictions, it's going to be incredibly important to share their successes with the rest of the nation. The goal of the Ending the HIV Epidemic is to eliminate 75% of new infections in the first 5 years, and we cannot do that if we're only focusing on places that account for about 50% of new infections. We know we have to look elsewhere and make progress there as well. So I can speak from NASAD's perspective that we're working closely with state and local health departments to ensure that sort of best practices are shared and that people can take some successes and implement them even without being named an official ETA jurisdiction.
Great. Maybe one more question because we're almost at time, but one question is, you mentioned earlier that add-ons were attached to the COVID-19 bill. Can you mention those add-ons that impact our work?
Sure. So there's been 3 COVID-19 bills, each longer than the rest, but I think the kind of most relevant was the most recent one, which was passed and signed into law on Friday, and that's the CARES Act, or the CARES Act, not to be confused with the Ryan White CARE Act or the CARES Act, but the CARES Act. And that included $90 million for the Ryan White program and $65 million for HOPWA.
Great. Thank you. I think that's what we got time for.
So I just want to remind everyone that this is now our advocacy break. You can see on the screen, there's a link that will bring you to an United AIDSWatch action place. So please do that.
Awesome. Great. Thanks, Emily. Thanks, Ronald. Thanks, Kenyon. Thanks, Christopher. And
Thank you, Malcolm.
all right, guys, everybody else, enjoy the rest of the sessions. Just a personal plug, Ronald and I will be facilitating an HIV and aging session at 4, so come see us there. Thanks, everybody.
Great.
Thank you.
Bye-bye.